Hello everyone, I hope you're all well. Quickly, in patients, I want to show you how to clean these. By the way, these are the silicone splints that we use in the septal rhinoplasty surgery. After the surgery, we replace them inside both sides, and as you can see, you can breathe through these tubes. So all you need to do first 3 days, especially because of the bleeding will be more, you need to keep this clean with using nasal saline spray every 2 hours, sniffing in and cleaning the entrance with the cotton buds. And as I said, the first 3 days, the most important 3 things to do is the ice compress every hour, 10 minutes, spraying as much as you can, cleaning these tubes and applying the antiseptic creams on your sutures. The rest 4 days you will be resting again, eating well, but actually avoiding exercise and hot showers. And we're gonna see you after 7 days to remove these, and then everything will be fine. So just wanted to show you these, how they are like extremely flexible. As you can see, quite flexible, quite soft. It's not going to affect anything. It's not going to give you pain. It's a little bit uncomfortable when we're removing them, but that's all. So if you have any questions, just let me know. I'll see you soon.